Hi, I'm Christine Weisselberg. I'm a nurse practitioner and director of the breast center at Englewood Hospital. We offer screening mammograms for women who come in and just want to have their annual mammogram, their yearly screening mammogram. And we have diagnostic mammograms for women who have symptoms. So either maybe they felt a lump or they have pain or their doctor saw something or felt something abnormal and they sent them here to be evaluated and to have a mammogram. All screening mammogram patients are offered real-time, immediate results for their mammograms. So we take that anxiety away from waiting, for having patients waiting 2, 3, 4 days for someone to call them and to tell them what their results are. We have nurse practitioners and physician's assistants, and they examine every single patient before their mammogram. So if we perform a clinical breast exam and we feel something, we put a little marker on it, we take some additional mammogram images, and we have the patient be seen immediately by the pathologist. And if they examine the patient and they agree that they feel something abnormal, they'll put a small little needle in it and perform something we call a fine needle aspiration. We obtain some cells. Those cells are put on a slide. The slide is stained, and we have an answer in probably 10 to 15 minutes. So we don't perform an MRI on every single patient who's diagnosed with breast cancer, but the radiologist may recommend an MRI if a patient has very dense or glandular breast tissue, and if they are concerned that there might be a malignancy somewhere else, either in the same breast or in the opposite breast. So an MRI is going to provide more added information about what could be happening and if there's additional pathology or abnormality or malignancy in the same breast, the lymph nodes, or the opposite breast. So we have the ability to estimate from these models that we have a patient's risk. If the model calculates that somebody has greater than a 20% lifetime risk, the radiologist will immediately recommend a high-risk genetics consultation, and that will take place immediately, or the patient can schedule that appointment, whatever is better for her. But almost all newly diagnosed patients who are young or who have a family history will see the nurse practitioner who has her advanced certification in genetics that very same day. Every Wednesday, we have our breast cancer conference. So we introduce and present every single patient who was diagnosed from the previous Wednesday. Present the slides, the pathology slides, and there are a team of experts in the room at that time. There's about 30 of us who sit in the room. So it's medical oncologists, surgical oncologists, the breast surgeons, the plastic surgeons. We have the radiation oncologists there. All of the nurse practitioners from the different doctors' offices are there. The navigator, the social workers are there. It's very, very unique. It's a team of 30 people actually deciding on what the patient's medical and surgical plan of care will be.